Let's talk a little bit about nutrition and how nutrition can actually not only impact your overall wellness, but how it could possibly play a role in pain relief and pain modulation. So let's consider what is on our plate. What are we putting in front of us at our meals and snack time? Did you know that diet can actually influence your pain perception and could be a factor in making you feel more pain or less pain? And the reason is pain is usually associated with increased levels of inflammation in the body. And we all have heard the term inflammation or anti-inflammatory medications or supplements. And our diet, what we're eating day in and day out, can actually be contributing to the inflammation, can make us feel more pain. Or our diet, if calculated correctly, can actually be anti-inflammatory because there are pro-inflammatory foods and anti-inflammatory foods. So besides diet having an impact on our levels of pain and our pain perception, we all know that diet can greatly influence our health. And it can actually increase or decrease our risk for chronic illnesses and diseases. And the chronic illnesses and diseases that plague our country and all of us as a whole, such as stroke, cancer, heart disease, diabetes, depression, many of these things can greatly be reduced or prevented with proper diet and supplementation. So let's look at what would be considered a pro-inflammatory diet. A diet that can be contributing to increased levels of pain or sensitivity to our pain modulation and pain relief, and a pro-inflammatory diet that could be contributing to increasing our risk for illness and disease. What does that look like? Well, it just so happens to be that 60% of the American diet would be considered pro-inflammatory. Now, this includes things that are high in sugar, such as soda or candy, processed carbohydrates, such as white breads, white pastas, omega-6 fatty acids, such as the fatty acids found in peanut oil, corn oil, soybean oil, a lot of salad dressings. These are the type of fatty acids that we typically fry our foods in. Now, this is problematic because when we consume these foods, these pro-inflammatory foods, and our body breaks them down, it triggers an immune response almost similar to what would be triggered after an injury. Now, after an injury, triggering an immune response is good because it promotes healing in the short term, but in the long term, we don't want to be consistently triggering an immune response after every meal. So let's talk a little bit about inflammation. What is inflammation? Well, inflammation is the body's response to injury or distress. It is actually not swelling. The two are not synonymous. You could have swelling without inflammation, such as the swelling we get after we eat a high salt meal, or if we've been traveling for a while on a plane, our legs may swell. And you could actually have inflammation without swelling. And that's what happens in chronic inflammation that we're going to talk about. So in the short term, inflammation is good because that triggers the immune response to promote healing. We bring blood flow to the area. There's healthy cells that are going to be generated to that area, all geared towards repairing the injured tissue and healing. But in the long term, it's actually damaging. And chronic inflammation is widespread inflammation that affects the entire body. When we sprain an ankle, it's confined to the ankle. The inflammatory response is localized. But when we consume a diet that triggers these same inflammatory processes within us, that could affect everywhere. That could affect our heart, our lungs, our joints, our bones. And if we look at the chronic illnesses and diseases that plague us, they all have chronic inflammation as an underlying factor, such as heart disease, Alzheimer's, autoimmune disease, cancer, lupus. And that is because the inflammation, when present for a long time, is damaging. And what the research has shown us is that this chronic inflammation can actually trigger degeneration of our joints, cartilage, and tendons. And we hear all the time from patients that they got an MRI and they see they have disc degeneration or they have tears in their rotator cuff, but there is no known trauma or cause for that. But what we're now learning is chronic inflammation can be a key in initiating those processes, or at least play a role. Now, many things could cause chronic inflammation. There's a genetic component, but for this presentation, we're going to talk about how nutrition and those pro-inflammatory foods can contribute to chronic inflammation, and why consuming a healthy diet is not only beneficial possibly for pain relief, but overall health and wellness. So we have a direct correlation between our diet and disease and pain levels. And that is again because the foods that we eat that are pro-inflammatory, the fried foods, the breads, the pastas, all break down and trigger an immune response just like an injury. Now, the chronic inflammation that comes along with constantly triggering an immune response with the foods that we're eating, that could take years to develop into anything disease-wise or any kind of symptoms or even any way to possibly affect your pain. So you may be eating a pro-inflammatory food for the last 15 or 20 years with no problem. You may have been going to the doctor and your doctor said you are healthy, no problems, you feel fine, you don't have pain. But now within the next year you go for your follow-up physical, and 6 months or a year later, and all of a sudden you have high blood sugar, or you have diabetes, or high blood pressure, or high cholesterol, or any other diseases we could think of, and now it's a problem. So it's almost like it's the straw that breaks the camel's back. The issue has been there and kind of brewing within yourself for years and years, and it finally manifests into something. And that's why this could be so dangerous, because problems could be developing with below our level of consciousness or before we get any kind of symptoms. So it's different than the inflammation and the response after an injury that comes on quick, it's localized and goes away quick. This type of diet-induced inflammation is slow, develops slowly, and can take years for it to develop into anything symptomatic-wise. So we all know that poor diet can lead to obesity. Now, obesity in and of itself is a problem because having a lot of fat or belly fat is actually inflammatory in and of itself. So now you're having a poor diet that is pro-inflammatory in the immune response that the food is breaking down into and triggering. And we know through research that the fat itself produces inflammatory chemicals and triggers an immune response just in and of itself from being the fat cells. So we have the fat cells and the food all further triggering an immune response, all further influencing our pain levels possibly and contributing to chronic illnesses and diseases like asthma, diabetes, obesity, heart disease, high blood pressure, and the list goes on and on. So besides the inflammation that the obesity and the diet is inducing, having excess weight on you puts more weight on your joints and bones and could further put you at risk for developing pain and chronic pain. So you have the physical aspect of carrying around more weight and the inflammatory aspect of the fat itself, all triggered by and affected by the food that we're eating, the food that is on our plates with each meal. And then as we are eating unhealthy, we gain weight, we usually become more sluggish and more inactive, and inactivity in and of itself leads to more obesity because we're not burning as much calories. And inactivity is another risk factor for developing inflammation. So you could see we have this kind of perfect storm brewing that all feeds off of itself, that could all be significantly influenced by our diet. So an emerging concept that has been gaining a lot of attention in the last 10 years is the role that our gut plays in our overall health and well-being. So what we refer to as our gut health. Now, the foods that we are eating can greatly affect our gut health, and as we're going to talk about, our gut health can greatly influence our mood, can influence things like pain levels, our quality of sleep, because the gut is so important. It's actually been known as the second brain because there are more nerve cells in the gut than actually in the spinal cord. And the gut is responsible for producing important chemicals such as serotonin, which plays a role in our mood, which plays a role in the development and formation of melatonin, melatonin plays a role in sleep development. So the gut is very important. And the reason it is important is because our gut has a wealth of bacteria in it. There's good bacteria and bad bacteria. That's what we call our microbiome in our gut. And if there's an imbalance between the healthy bacteria and the bad bacteria, and the bad bacteria is kind of taking over, when the bad bacteria is dominating, they can actually trigger the immune system and trigger an immune response, because we know that the gut communicates with the immune system, communicates with the brain. They're all interconnected. So if we're not taking in a proper amount of fiber, if we don't have prebiotics, if we're not taking in healthy bacteria in the form of like probiotics or supplementation with probiotics or natural probiotics found in yogurt, we can get an imbalance in the bacteria, and the bad bacteria or the unhealthy bacteria can contribute to chronic inflammation, which further, as we've said in the past, leads to chronic illness, disease, and altering pain levels. So besides having an influence on pain levels and influence on the development or prevention of chronic illnesses and diseases, diet, which is a major pillar of health, can actually influence another major pillar of health, sleep. And we just talked about how diet can affect our gut health, and being that a majority of our serotonin, and which breaks down into melatonin, is produced in the gut, if we're not taking in an adequate amount of nutrients to be able to form serotonin and inherently melatonin, our sleep can be affected in that way through our gut connection. But also, if we're taking in a lot of caffeine, that can, obviously everybody knows caffeine keeps you awake, it's a stimulant, but what a lot of people don't know is caffeine has a half-life of about 5 to 7 hours, meaning if you have a cup of coffee at 12 o'clock, there's still 50% of that coffee present in your bloodstream 5 to 7 hours later. Now, many of us will have a late afternoon or even an evening cup of coffee, and maybe we think that that's going to be out of our system 3 hours later, but that coffee could stay in you for an additional 5 to 7 hours. So if our diet entails a lot of caffeine, that could affect sleep, which affects our overall health. Alcohol is another big one because many people think that alcohol actually helps you sleep better. Well, the truth is that if you consume alcohol, it may help you fall asleep, or you may feel that you slept for 7 or 8 hours, but the studies show that you have multiple micro arousals during that sleep period, so you're not getting access to those deep REM levels of sleep that you need. So the end result is, yes, you may be unconscious for 7 or 8 hours, but you're not getting the same type of sleep that you would if you weren't consuming the alcohol. Because alcohol is a nervous system depressant, and it interferes with your sleep-wake cycles. Not only that, besides caffeine and alcohol and our gut connection, having big meals before bed can lead to digestion issues or bloating or rapid spikes in blood sugar. So these are just some ways that our diet can influence sleep. And again, all of the major pillars of health interact with each other and influence each other either positively or negatively. And as we have kind of mentioned already in previous slides, food definitely affects your mood because if you're eating a pro-inflammatory diet, you're likely not getting the most nutrients out of the food you're eating to generate important hormones and neurotransmitters that we need for energy and a good quality of life. A poor diet has actually been linked to depression. And we know that one of the chemicals that are important for depression or the generation of depression is serotonin. So we already said that a lot of serotonin is made in the gut. Now, if we don't have the building blocks of serotonin, or if we have issues with our gut health because we're not taking in the proper amount of fiber and probiotics, we may be affecting the important neurotransmitters that we need to have a good, healthy mood. Not only that, a lot of people even report when they're eating healthier, they just feel healthier. Or when they're eating fried, heavy meals or sugary meals, they just feel sluggish or they don't have the energy. So food definitely affects our mood. So now that we've spent a lot of time talking about inflammation, diet-induced inflammation, and the effects that inflammation has on pain and disease, let's look at what the other end of the spectrum has to offer, an anti-inflammatory diet or an anti-inflammatory food pyramid. And as we said, chronic pain and chronic disease is associated with high levels of inflammation. So if we could put things on our plate that are anti-inflammatory, it's almost like the food is acting as our Advil or our naproxen. So taking in an anti-inflammatory diet is a safe, sustainable way to reduce inflammation naturally without having to take Advil or naproxen regularly. It's going to be better for your body as a whole. There's no side effects. So at the base, obviously, is water. We all want to take in water. Water is essential for every bodily function, and we talk a little bit more about that in another slide. But basically, an anti-inflammatory diet is a diet rich in fruits and vegetables. Make your plate colorful. Eat the rainbow. That's a good expression that I like to follow. Then we have whole grains. So whole grain carbohydrates, pastas, things that are not processed and refined. And then we have the healthy fats. So the healthy fats are actually rich in the omega-3 fatty acids, which is different than the omega-6 fatty acids we talked about. So the omega-6 fatty acids are the fatty acids that we typically fry our food in, like soybean oil, corn oil, vegetable oil. The healthy fats, such as olive oil, coconut oil, avocado, those are the anti-inflammatory fats that we want to load up on. Things that are found also in nuts, seeds. Fish and seafood are rich in the omega-3s. So that's what we want to spend the majority of our calories eating. We also are going to incorporate cheese and eggs and other healthy herbs and spices that we're going to talk about that have an anti-inflammatory effect. If we're going to have alcohol, we want to consume red wine. Red wine is definitely anti-inflammatory and has a lot of benefits overall for health. So if you are going to consider or consume alcohol, consider red wine. And then at the top, we could treat ourselves with dark chocolate. Dark chocolate is very healthy. It has a lot of antioxidants and a lot of anti-inflammatory benefit. So if we are craving something sweet besides fruits, we also have the dark chocolate as an option. Another option we have to kind of supplement our diet if we feel like we can't make the necessary changes that we need to affect our symptoms or affect our health, we can start to supplement with some anti-inflammatory supplements. Now, besides the overall supplements I recommend for everybody, multivitamin, vitamin D3, magnesium, there are some herbs and spices that are considered anti-inflammatory that have been around for centuries, specifically ginger root, turmeric root, and these all come in capsules or a powder form, or you could start to incorporate them in your meals regularly. Two other supplements that have been known for their anti-inflammatory effects are alpha-lipoic acid and coenzyme Q10. And obviously, as we talked about, you can supplement with omega-3 fatty acids if you are not a seafood person or you just can't consume the amount of seafood that would give you that benefit. And I always tell people to start out by following the recommendations on the bottle and then go from there. Now, you may not want to do all of this at once. You may start out with just the base of a multivitamin, D3, and magnesium, and then see how fish oil works for you, the omega-3 supplements. Give that a month or two. If you're not seeing real benefit, then try one of these other supplements, or try incorporating ginger or turmeric into your meals regularly, and just monitor the effects. Because the truth is, we don't yet know. We don't have an exact protocol of supplementation or an exact diet regimen for everybody that we know is going to prevent this disease or we know is going to help curb this level of pain. So a lot of this is based on good research as far as we know having a healthy diet affects pain and chronic illness, but we don't know an exact recommendation for everybody. So a lot of it's trial and error and just using good common sense. I always tell people to check with your doctor before undergoing any kind of supplementation regimen, just to make sure if you are on any medications currently, there are no interaction or side effects that could be detrimental for you. So now that we know a little bit about a pro-inflammatory diet and an anti-inflammatory diet, what do we do with this information? How do we integrate the information that we learned and putting it into practicality? Well, what I tell my patients is, almost like with any advice I give them, is make small changes one meal at a time. Take each meal, meal by meal. Don't think too far in advance. Look at what you're about to put on your plate or what you're thinking of putting on your plate and see what you could change. Can you substitute that piece of white bread or French bread for a whole grain bread? Can you add maybe a sweet potato or some kind of vegetable to your lunch and swap out the pasta? Can you add some olive oil on top to get some extra fat or some avocado? So it doesn't have to be complicated. You can make diet and nutrition as complicated as you would like, but most of the time that leads to frustration and it's not sustainable. The key is consistency. Like anything else in life, we have to be consistent and make small changes. And then over time, as we kind of master those changes, we can make further changes. I don't recommend just trying to switch your entire diet around or trying to implement all this stuff at once, because you may be able to do it short term, but chances are in the long term, you'll resort back to a mainly pro-inflammatory diet and lifestyle. So do what you can with what you have. Just being mindful each meal. If you have a bad meal or a bad day where it's mainly a pro-inflammatory, don't get too down on yourself, but the next day or the next meal, see if you could do a little bit better. And as we said, let's not forget the importance of drinking water. As we see here in this slide, water is so beneficial for all of our bodily functions. When we're dehydrated, we could feel sluggish, dizzy, nauseous, we could cramp, and water actually helps to lubricate the joints. We are made up of mostly water. The old recommendation of 8 8-ounce glasses of water per day, that's a good starting point. Depending on your activity level and other factors, you may need more or you may need less, but just be mindful about consuming a good amount of water per day. And water doesn't have to be boring. You could put fruit in your water, lemon in your water, but try not to actually consider that you're having water if you have like iced tea, or if you're drinking soda, you think, oh, well, there's water in there. You want pure water, again, with some added fruits in it. There are ways you could kind of spice it up. So hopefully you have a better idea about how diet is influencing not only our health, but our pain levels, and ways that we can intervene to kind of not only make us healthier, but to possibly control or manage the amount of pain we're feeling. Diet is just one pillar of a healthy lifestyle, and that should be combined with stress management, physical activity, and sleep, along with other recommendations such as losing weight if we're obese, or consider stopping smoking, things that just will make us more healthy as a whole and will significantly benefit our levels of pain.